The Healthy Ageing strategy is all about supporting our ageing population, and it's growing. What we wanted to do was to bring the policies, the funding, the planning and the services together to make sure that older people really had the opportunity to live a really good life. Well, healthy ageing is not just about health services, actually. It's about being independent, it's about being connected, it's about being in a community. It's all about one team, and this team is health professionals, but it's also in the community, it's families, everybody working together to support older people.
I think this is a really important step for the future. The Healthy Ageing strategy is an exciting new way of looking at how do we make sure that our population ages well and healthy and stays in their own homes and communities, which is what we need them to do for the future. And what this strategy is described is how we can take a whole of government approach to that. It's about changing the expectations for people about how they can age and what they can expect from their lives, and then giving them the tools to make sure that it works out for the best possible way for them. In health, we tend to start from people being unwell, and in this case we're trying to say how can we support people to stay well, which is why it needs that whole of government approach. So there will be quite a few things we have to change. The most important thing we'll have to change is people's expectations. Expectations about what support they can get, but they're also their expectations about what life they can live.
Some of the things that our kaumātua have said around the healthy ageing strategy is, one, that it's good to see a government strategy that is purely focused on them. Two, that it's really good to see something that identifies Māori as a priority population, because our kaumātua in particular have, I guess, an extra burden in that they die earlier, and so that's something that we're trying to address, and I believe the healthy ageing strategy just gives a little bit more emphasis to their voice. The best outcome for me would be kaumātua being respected so that their dignity is maintained, and that as a health system and as a nation that we have systems that demonstrate that they are valued. I think the actual implementation requires everybody to be part of that process for it to work really well.
People work better when they're connected to their community and they're connected to each other. And really the action strategy is about delivering in those things, getting people engaged in planning, town planning, planning about exercise and footpaths and the location of shops and the location of other services. It's about trying to make sure that the services that people need are built around the people who need them. And the best advocates for that are the people who are in their own community. It just requires people to be interested and want to be engaged and supported when they make those decisions. And that's the key in a lot of that healthy ageing strategy.
My involvement in the strategy and our organisation's involvement in the strategy is being the voice of the people, being included in the conversations, looking at what the needs are at local community level, looking at how we could put in some protection and support. In terms of the strategy, it actually is for everyone. It's from the tip to the tail of New Zealand. It's for every New Zealander. It's a living document that can influence how we do things. It can influence how we get involved in local communities. It gives us the permission to have a start of a conversation. It gives us the mandate. This strategy enables us to shift, to own, to be part of the decision making as well.
The importance of a social movement, the importance of New Zealand understanding that we want people to live really well into older age and to feel really supported in their communities. The more people that we have involved, and not just the people who provide services but also the communities where people live, the more likely we are to be successful, because we know that the things that really affect your well-being as you age are about things like loneliness, what we call social inclusion, being part of your community, and you need to get everyone involved. Having that how conversation is really about unpacking the detail of who takes what responsibility, but also who's got what opportunities to make this really successful.
As clinicians, we're a prime target for implementing this strategy, and we have a very experienced and dedicated workforce, both in the regulated, that's doctors and nurses and so forth, allied staff, as well as long-term care workers and community workers. Very dedicated, very skilled and very capable. Without a strategy, it's very hard to know your direction, and if we don't have a common goal, we're likely to drift off. So, for my mind, it's join in, participate, produce the actions, we can model off good examples and propagate that around the community as we need it to be. So all clinicians with an enthusiasm for doing more with what we've got. I would expect those who don't get involved to be sadly disappointed that they're not on the leading edge of growth and development.